Before we talk about the surgery, I have to mention once again that in general, as spine surgeons, we like to operate for buttock and leg pain, which is sciatica, not back pain. And that's because back pain is multifactorial, can come from many different things. Even if we identify as a disc, all the outcomes research shows us that the anterior lumbar fusion surgery for degenerative disc disease is only about 70% successful. That's just okay when it comes to surgery. For most surgeries we do, like laminectomies or discectomies for buttock and leg pain where you take the pressure off the nerve, those outcomes are 90% plus. So before thinking of having surgery for degenerative disc disease, I have to emphasize again, make certain that 6 months of conservative care, 6 months of non-operative care with different physical therapists, weight loss, getting a standing desk, core strengthening, all the things we talked about on the last episode, you have to do before even thinking about having surgery for degenerative disc disease. Surgery for degenerative disc disease really has to be the last option. We talked about peer-reviewed literature, and VAS is the one we're interested in. This is the dark bar here. And VAS is essentially visual analog scale. Again, 0 is no pain, 10 is the most pain in your life. And this is the percent reduction of back pain compared to pre-surgery. So these are patients post-surgery, and these are all different papers or trials that have been published using all different types of fusion, and in fact includes some lumbar disc replacement. This black line is the average, and it hovers at around 45%. So think about that. I just told you there's a 70% success rate, meaning there's a 70% chance that you'll have around a 45 to 50% reduction in pain. Again, that's just okay. Many patients think they're going to be 100% pain-free, and that's in fact not the case. I always tell patients, don't expect to be totally pain-free. I give them a 70% chance that half of their pain will go away. In fact, there's a 30% chance that their pain might not change at all, and a couple of percentage point chance that their pain would get worse. So again, real caution to having surgery for degenerative disc disease. There is definitely a subset of patients for which fusion for degenerative disc disease has a better than 70% success rate. We've done some of the research in our own clinic, and we're looking at publishing this data. And when you start looking at different factors that drive patient success, those include things like complete failure of 6 months of non-operative care, benefit from a functional anesthetic discogram, having that one level be the only degenerative level on the MRI, so the other levels look pretty perfect. Something called modic type change, we talked about this and I'll show it today again, and that really means the disc isn't just dark, but the bones are rubbing against each other, so there's inflammation in the bones, and you can see that inflammation on the MRI. And most importantly, patients that are non-obese, non-work comp, meaning they have a job to go back to or they're currently trying to work. When you take all those factors together, in our practice, in our registry data, there's an over 90% success rate. So I do really think that there is a subset of patient that does qualify for this, and probably around the country, not all patients have been specifically selected for surgical success. So the anterior lumbar fusion is a great operation in the right patient with the right preoperative studies, and that includes weight loss, 6 months of non-operative care, single level disease, bony end plate changes, and most importantly, a good outcome from a functional anesthetic discogram. And it works for Tiger Woods, then it could work for you. Thanks for watching this episode. Don't forget to click the like button and leave questions or feedback in the comment box below. And feel free to let me know what videos you would like to see in the future.